In 2025, the international community must focus on global health financing and work in partnership with all actors, governments, the private sector, civil society, and global institutions. Platforms like the Global Health Hub Germany play a critical role in fostering dialogue and developing innovative ideas to address these challenges.
I am looking at it from the persons with disabilities lens, and it has to be a whole lifespan approach, whereas from the childhood till the old age, the health needs to be there, it should be ensured, and it is a right. Human right cannot be denied. So lifespan approach, holistic approach, and it should be comprehensive, covering all the requirements of health from diagnosis, treatment, nutrition, assistive technology or palliative care, or for persons with disabilities we need caregivers. So all these aspects comprehensively should be covered within the health agenda.
So many, but if I had to pick one, I think we really need to come to terms with how we're going to work in countries affected by fragility, conflict and vulnerability. We're seeing a world in which the poorest people in the world are being concentrated in a smaller and smaller number of countries, where the effects of climate change, conflict, displacement are really having a massive impact on people's lives. That's where the children are dying, that's where the mothers are dying. And we've really got to rethink how we engage in those countries, because governance is weak, access is weak, security is poor, and unless we find better ways to operate in those countries, we're never going to get the SDGs, and we're always going to be at risk of major epidemics.
As we head into 2025, we face a crucial year for global health amidst political shifts and ongoing conflicts across the world. It's imperative that the international community continues to collaborate across borders, sectors, and disciplines. We are closing out another hottest year on record and already see how climate change is impacting the health of millions around the world. This is why we at Wellcome eagerly anticipate the COP30 in Brazil. It holds the potential to significantly advance the integration of health into climate action, empowering countries to accelerate their mitigation efforts and adapt to our changing climate. Let us all seize all opportunities in 2025 to drive meaningful progress for a healthier world.
We will see a moment of truth next July, when the UN High-Level Political Forum will review Sustainable Development Goal 3. We're actually still lagging behind on many of the goals and targets for health. I would like to see the global community to continue its efforts towards universal health coverage and towards achieving the SDGs within the next 5 years. There's not much time left.